software where we can adjust the protocols. After the diagnosis of OCD, we do the screening so that he will be fit for this treatment. If you notice this, there is a grid here. If you see the grid, there are different lines, and there is a one red line which we have to adjust exactly to the point of Nasion, and then the level 1, it should not come down below the levels of eyebrows. On the first day, on the first time treatment, to check for motor threshold. The most important thing, motor threshold, is we will know what intensity of magnetic field we have to administer to this particular patient. Now you see what I have told you, when we apply a single stimulus, you are seeing the twitch on the right thumb. That means the helmet is placed in such a way, when we apply the stimulus, it stimulates the motor area of this particular person, and that is where we are getting the twitch. Based on this, we will judge what is the intensity he has to get and then proceed for the treatment. From the motor threshold area, we will come 4 points down, 4 lines down. If you observe here closely, now on the grid, you see the 3 points. One is the central red mark is in sync with the red mark of the helmet. If you see here, 2 small round red circles. On the right side, it is at the point 3. On the left side, it's at the point 9. And then above, it is at the level 4. That means on the right side, the helmet is positioned at 3-4. On the left side, it is positioned at 9-4. This treatment internal configuration of this coil is supposed to be doing the modulation mainly focused on medial prefrontal cortex, orbitofrontal cortex, and importantly, anterior cingulate cortex. Now if you look at here, this is the brainsway. The coil type is H7, which I have mentioned to you. And today's date, the patient's name is Anil Kumar, and then treatment session, diagnosis protocol is OCD. If you look at here, the empty helmet position, I think I told you on the grid how you position is. For the motor threshold, the position is given here 3-8 and 9-8, and then for the treatment position, we bring it down 4 lines down. This is exactly the position of the helmet on this patient's head. 3-4 on the right side, 3 on the right side and up 4 on the left side, 9 on the left side and up 4. This is what the screen is. Now, I want you to focus on this part of it, which is the main protocol. Here, if you look at this 20 heads. That means per second, 20 stimuli are applied. This is train duration. Then there is a gap, which is called inter-train interval, which is 20 seconds when the stimuli is not administered, and again it starts for the next train. Like that, we have about 50 trains we administer the patient, almost about 2000 pulses this patient will get in the next 20 minutes of the treatment. Now everything is set. You see here 2 small buttons, one is adaptation and the treatment. First we will generally try whether patient will be able to take it, how comfortable he is, like that. Let me do that. If he is comfortable, then we will proceed with the treatment. Now I am going to start the treatment for this patient. Right? We will start. Now you observe a 2-second stimulus. You see this green line. Now it's the inter-train interval. If you look at this, what is happening now is that inter-train interval of 20 seconds. Once the 20 seconds are over, there is going to be another burst of 2 seconds. Once again, inter-train interval. If you look at here, out of the total of 50 trains, 2 done now. Next time it will be 3. Right, now it is 3 trains done out of 50 total. This is how the treatment continues till 50 trains are completed. That is one session of deep TMS treatment with H7 for the OCD protocol. Thank you very much.